Imagine this. You walk into the pharmacy, the same one you've been going to for years. The fluorescent lights hum overhead as you step up to the counter. You're picking up a vital prescription, a medication you rely on every single day. Last month, your copay was $20. The month before that, $20. But today, the pharmacist looks at the screen, then looks at you with a sympathetic expression and says, "That will be $450. The air leaves your lungs. It feels like a punch to the gut. Shock, panic. What just happened? You've just fallen into the most feared, most confusing, and most financially devastating trap in the entire American healthcare system. You've fallen into the Medicare Part D donut hole. This isn't a mistake. It's not an error. It's a feature of the system designed to be complicated. But in this video, I'm going to pull back the curtain. I will expose the truth about your prescription drug plan. We will walk through the chaos. I will explain what the donut hole really is, and I will show you with crystal clarity how one simple mistake when choosing a plan can drain your retirement savings year after year. Stay with me, because understanding this is the key to protecting your financial future. So why? Why is this one part of Medicare a separate nightmare? The first question everyone has is why prescription drugs aren't just covered under their main medical plan. The answer is a ghost of history. When Medicare was born back in the 1960s, a hospital stay was the biggest financial threat. Pills and prescriptions weren't the multi-billion-dollar industry they are today, so they simply weren't included. Fast forward to 2006, the government finally admitted this was a massive problem and created Part D. But they didn't make it a simple government-run program like the other parts. Instead, they did something that created the chaos we live with today. They outsourced it. They handed the entire system over to private insurance companies. Think about what that means. The government only sets the basic rules of the game, but the actual plans, the prices, the rules, the lists of covered drugs, all of that is managed by dozens of different for-profit companies. Each one is competing for your business. It's not a unified system. It's a chaotic marketplace with hundreds of different plans, all screaming for your attention, all promising the world, and all hiding their secrets in the fine print. Their goal isn't just to help you. Their goal is to make a profit. And that's why you have to be smarter than they are. To beat this game, you have to understand the map. And the map for every single Part D plan in America follows the exact same path. Your journey through the year is a journey through 4 distinct stages. Some people will only ever experience the first 2, but many will fall into the third, and that's where the danger lies. Let's walk the path together. The moment the calendar hits January 1st, your journey begins in stage 1, the deductible. This is the simplest part to understand. The insurance company will not pay a single dime for your medications until you have first paid a certain amount out of your own pocket. For this year, that amount is around $550. You pay 100% of the cost of your drugs until you hit that number. For some people with inexpensive generic drugs, this stage might last for months. For others with a single expensive brand name drug, you might blow through this entire deductible with your very first refill in January. Once you paid it, you move to the next stage. Stage 2 is called initial coverage. And this is the good part. This is what you thought you were paying for. After your deductible is met, the insurance plan kicks in and starts paying the majority of the cost. You are now only responsible for a small, predictable copay. That $20 or $45 fee you're used to paying, you're in the initial coverage phase. It feels safe. It feels secure. You think your costs are under control for the rest of the year, but they are not. Because while you're paying your small copay, the insurance company is tracking the full retail cost of the drugs you're receiving. And once that total number, what you've paid plus what they've paid, reaches a specific limit, everything changes in an instant. For this year, that limit is just over $5,000. The moment you cross that line, you fall. You fall into stage 3. This stage has an official name, the coverage gap, but everyone in America knows it by its more terrifying, more accurate name, the donut hole. And this is where the rules of the game are rewritten against you. Your insurance plan, the one you trusted, suddenly steps back. It dramatically reduces what it pays. Now, you no longer have a simple flat copay. Instead, you are instantly responsible for paying 25% of the full retail price of your medication. Let's go back to that moment in the pharmacy. That drug that cost you $20 last month, its full retail price might be $1,800. Last month, in the initial coverage phase, your plan paid the vast majority of that. But now, in the donut hole, you paid 25%. And 25% of $1,800 is $450. The system didn't make a mistake. It worked exactly as it was designed to. It was designed to shift the cost back onto you, right when you are most vulnerable. This continues, month after month. You are trapped. You pay this punishing percentage for all of your medications until your total out-of-pocket spending for the year reaches a very high threshold. This brings us to the final stage, Stage 4, catastrophic coverage. This is the safety net, but look at how much you have to bleed before you hit it. Once your total spending from your own pocket, including your deductible and everything you paid in the donut hole, hits this year's limit of around $8,000, you finally get relief. You're out of the donut hole. For the rest of the year, you'll pay only a very small amount for your drugs. It's a protection against total financial ruin, but it's a protection that only kicks in after you've already spent a fortune. Now, you might be thinking, this is a nightmare, but it seems like the rules are the same for everyone. And that is the single biggest misconception. The rules are not the same. Because the trap isn't just the donut hole itself. The real trap is choosing the wrong plan, which guarantees you'll fall into it faster and harder. This is the part they don't want you to understand. Let's make this real. Let me tell you about Maria. Maria is turning 65 and needs to choose a Part D plan. She takes two common but expensive brand-name medications, one for her heart, one for her diabetes. Now she's looking at two different plans, the green plan and the blue plan. The blue plan looks fantastic on the surface. Its monthly premium is only $15 a month. It's advertised everywhere. It seems like a great deal. The green plan has a higher premium, maybe $40 a month. So Maria, trying to be smart with her money, signs up for the cheaper blue plan. And in doing so, she has just made a $4,000 mistake. Here's why. The single most important word in any Part D plan is the one most people ignore, the formulary. That's just a fancy word for the list of drugs the plan agrees to cover. It is the secret heart of the entire system. Let's look at Maria's year under the blue plan first. She goes to the pharmacy in January. She finds out that one of her drugs, the one for her heart, isn't on the blue plan's formulary at all. The plan refuses to cover it. She is forced to pay the full retail price for it every single month. That one drug costs her $600 right out of the gate, instantly blowing past her deductible. Now, for her second drug, the one for diabetes, it is on the formulary. But because the massive cost of her first drug is being tracked by Medicare, it pushes her total drug spending through the roof. By June, she's blasted through the initial coverage limit and has fallen deep into the donut hole for her diabetes medication. For the rest of the year, she is paying a punishing 25% for that drug on top of the full price for her heart medication. Her total out-of-pocket cost for the year? A devastating $4,200. Now let's rewind. What if Maria had chosen the green plan, the one with the higher monthly premium? She was hesitant, but she did her homework. She discovered that both of her medications were on the green plan's formulary, and they were listed as preferred drugs. Yes, her monthly premium is higher, but when she goes to the pharmacy, her copay for both drugs combined after her deductible is just $45 a month. Because both drugs are covered, her total spending grows much slower. She never even gets close to the donut hole. She stays in the safe, predictable initial coverage phase all year long. Her total out-of-pocket costs for the year, including her higher premiums, just over $500. Let that sink in. The exact same person, the exact same two medications, one decision, one choice of plan. And the difference isn't a few dollars. The difference is between spending $500 and spending over $4,000.
It's the difference between a secure retirement and a year filled with financial anxiety, all because one plan looked cheaper on the surface. The truth is, the monthly premium is the least important number. It's a marketing gimmick designed to lure you in.
So how do you avoid this catastrophe? How do you find your own green plan? There is only one way. It is the only weapon you have in this fight, and you must be willing to use it. You cannot trust the television commercials. You cannot trust the junk mail flooding your mailbox. And you cannot simply choose the same plan your neighbor has because your neighbor does not take your medications. The only way is to take back control. Step 1. You must become the master of your own information. Take out a piece of paper, open a document on your computer, and write down the exact name, the exact dosage, and the exact frequency of every single prescription drug you take. No exceptions. This list is your golden ticket. It is the most powerful tool you possess. Step 2. You must go to the source of truth. You need to ignore the private insurance websites and go directly to the official government-run Medicare website, medicare.gov. On that site, there is a tool. It is called the Plan Finder tool. This tool was designed specifically to solve this problem. It is free, it is unbiased, and it is the only thing that can cut through the lies and confusion. Step 3. You must use the tool correctly. The Plan Finder will ask for your zip code. It will then ask you to enter the list of medications you just created. You enter each drug one by one. This is the critical step. Once your list is complete, the tool will perform a miracle. It will electronically scan every single Part D plan available in your area. It will check every one of their secret formularies, and then it will show you the results. But here is what you must look for. Do not look at the monthly premium first. Do not look at the deductible first. You need to scroll to the column that says Estimated Total Annual Cost. This is the magic number. This number includes everything: the monthly premiums for all 12 months, the deductible, and all the estimated copays you will pay, even the costs you will face if you fall into the donut hole. It calculates and combines everything into one single powerful number that tells you the truth. It tells you what each plan will actually cost you based on your specific drugs. That is how you turn the tables. That is how you see that the cheap $15 plan might actually cost you $4,000, while the $40 plan might only cost you $500. The Plan Finder tool exposes the lie. It turns a complex, emotional decision into a simple mathematical one. So the truth about Part D is this: it is a deliberately complex system. It was designed with traps and loopholes that benefit the insurance companies. But now you have the compass. You have the map. You know the secret. Remember the 3 truths. First, all Part D plans are private, and they are not created equal. Their formularies are different, and that is what matters. Second, the donut hole is real, and it is a financial threat you must plan for. And third, the only way to win is to use your personal medication list on the official Medicare.gov Plan Finder to compare your estimated total annual cost. If this video has brought you even a small amount of clarity, if it has armed you with the knowledge to protect yourself, then please do 2 things for me. First, hit the subscribe button and join the Medicare Compass community. Our mission is to continue lighting the path and guiding you through every complex part of this journey. Second, think of one person in your life who is approaching 65 or is already on Medicare and struggling. Share this video with them. You could be saving them from a year of financial hardship. And leave a comment below. Are you shocked by how the donut hole works? Have you had a bad experience with a Part D plan? Let's share our knowledge, because in this complicated system, the only way we can be sure of our footing is to walk the path together. Now, your next critical decision is understanding the massive difference between Original Medicare and Medicare Advantage. Watch our next video on that topic, because that is another choice that will define your future.